So Beth Sykes was a woman who was about 22 weeks pregnant and came into the hospital over the weekend through the emergency room with some respiratory symptoms that seemed to be consistent with a pneumonia. The problem was it rapidly progressed after she was admitted to the floor, and she needed to be brought down to the intensive care unit because her respiratory status was worsening considerably fast. But the problem that we were dealing with was not only the fact that she was sick, but that she was carrying a baby also. That wasn't quite far enough along to be considered a viable fetus at that time, but still it was part of the consideration that we had in dealing with her.
So they had to decide, me or the baby, and of course they chose me, but luckily we both have survived the whole situation.
The thing that stood out for us was that we were trying to take care of two patients at the same time, and trying to make sure that all of the therapies that we did to benefit one didn't harm the other. And so having the time to sit down with our colleagues in obstetrics and my colleagues in infectious disease to be able to work through a coordinated plan of care, I think is the thing that stood out. At the point that we determined and diagnosed her with preeclampsia, then to a certain extent the clock's ticking for both her and for her baby. And if the baby's not delivered, then there's a very high likelihood that both she and the baby will die from this. So that was the situation we were presented with. We needed to give her the definitive therapy, which was to have a C-section and remove the baby that was really part of causing the problem, at minimal risk to both her and her baby. Transporting her to another facility would have put them both at risk, and in trying to save one patient, we could have lost both of them.
I was scheduled on a Wednesday to go down to the OR to get my trach and my peg. Tuesday before that Wednesday, Dr. Brath comes down the hall and says if Beth wants that trach or that peg tube, she's going to have to earn it. And that was his words to my mother in front of me at my bedside. They extubated me, which means they took the tube out of my mouth to see if I could handle breathing on my own. When they did, they took that tube out of my mouth. I never went back. I never needed the trach, I never needed the peg. I just continued to prosper and grow and get better from that point on. And for that, I am thankful.
And so minimizing the risk and performing the surgery here and continuing the therapy here was really, between all of us and including the folks at the other facilities we talked to, was the best thing, the safest thing for both her and the baby.
High Point Regional Hospital to me is a community hospital. It's not a commercial hospital. It is a community hospital, and it takes time to come to you on a personal level, not on a business level per se, like not looking at you like you're my next dollar. They're looking at you like you're my patient, you're my family member, you're my sister, you're my mother, you're my father, you're my child. That's what they look at you, and that's how they take care of you, is that way. They don't look at you as the next dollar or the next person in that bed, knowing that 15 minutes later there may be another one. They take the time and they push other things aside and they take care of you, because right then, right there, you are important to them. Dr. Brath is my knight in shining armor. He is an exceptional doctor with hands of gold, and the doctors, the staff that took care of me at High Point Regional saved my life.
It was a typical Saturday afternoon on January 5th, and one of my good friends and neighbor asked me to go run an errand with him. He was persistent enough to make me get into his truck with him and go one Saturday. And 5 minutes after I got into the car, I collapsed over in his car, and he called 911.
He had a focal spasm of the right coronary artery, and that's called Prinzmetal's disease. In 21 years, I've seen it maybe twice, 2 other times. It's usually more common in females who are heavy smokers. But he had it. And when the right coronary artery spasms, the heart doesn't get enough blood, and ventricular fibrillation happens, and then you die.
But here I am standing because we were able to track my problem down. We were able to treat my problem, and I didn't just get lost in, in somebody else's hospital, wondering what was going on.
We've been a top 10 heart center in the state of North Carolina for the past 6 or 7 years running, and that's not so much, well, it has something to do with our work, but it also has to do with the hard work of the staff, and it also speaks to the fact that our hospital as an institution, with its board of trustees and administration, are forward-thinking enough to look to the needs of the community, the equipment, and all the technology that we need. That, in Tommy's case, if we hadn't had that technology, he probably wouldn't be alive today.
I didn't want to have to get transferred to some big experimental hospital where they take rare cases that no one knows what's going on. I'm staying here. I'm staying in my house. This is my home. This is where I work. This is where I spend most of my life here. I was able to have it all done here. I mean, the resources are here. My doctors are here.
And it was clear that his heart had ventricular fibrillation, which is a life-threatening, lethal arrhythmia. And so no matter what we found otherwise, it was clear he was going to get a defibrillator. And I found it kind of interesting that all those years of working in the EP lab with me, and he was in there getting his defibrillator in the same table where he had helped me implant many defibrillators.
It was kind of amazing. People throughout the hospital, through a career in the hospital, but all these other doctors would come back and they would look at me and say, we're glad you're back. We're glad you're doing well. It was very comforting. I mean, when someone falls in your home, everybody knows about it, and everybody comes and they talk to you. And that's pretty emotional. When people you don't even know, your night shift people, second shift people, weekend, and they see you, and you're standing back up, and you're back in your scrubs, and you're back on the floors. It makes them feel good too. I don't tell my story to everybody, but every once in a while I can tell that sometimes it might help, and I give them a brief insight to it. My name is Tommy Locke. I'm a patient at High Point Regional, and I'm a survivor at High Point Regional. It's an overwhelming moment when you're a patient, when you're suddenly laying on that table and you get to stand back up and go out and work and tell your story to people, because it's important. People need to know that you can stay right here in High Point and get everything you need done right here. You don't have to go anywhere and be a number. We're going to take care of you.
This morning on Today's Health, a daring choice to save a young girl with a debilitating brain disorder. NBC's chief medical editor, Dr. Nancy Snyderman, is here with her amazing story. Nancy, good morning.
Good morning, and it is an amazing story because little Cameron Mott was born a healthy, happy baby, but at the age of 3, things changed, and very quickly, putting her life on the line. The only hope, an extraordinary procedure for an extraordinary little girl, removing half of her brain.
The Mott family started their days like most other families. However, within an hour of awakening, their days were abruptly turned upside down. At the age of 3, their daughter Cameron started to have seizures, up to 10 a day.
Within 20 minutes or so, she would have her first seizure, and then they would just continue throughout the day. It was not any quality of life for her.
When I first got the order to see Cameron, the diagnosis I was given gave me no indication of what we were going to be looking at. So when I saw her, I really thought, since she was almost 6 years old at the time, that it was probably some problem that had resolved itself, and they just wanted me to check and be sure everything was okay. So when I walked into the waiting room, it was quite a shock to see this fragile-looking little girl with a big pink helmet on. All I could see of her hair were a little bit of the braids, the blonde braids coming out from under the helmet. She was very fragile looking, very clumsy, kind of moving around, so it was quite different. I evaluated her at that point, and like I said, she was almost 6 years old. Her speech and language skills were 2 to 3 years below age level. And when you're not quite 6 years old, that's a big chunk of time. I worked with Cameron 4 days a week for hour-long sessions, and at that time she was having seizures multiple times during the day. Generally, when we see a child who has a seizure during therapy, we would pretty much stop therapy and let them go home. But for Cameron, it just wasn't an option. She was having seizures all the time, so unless it was a really bad one and she had to get a shot and was sleeping after that, we pretty much had to give her a few minutes to recover and then keep going. So to see this little child have to deal with these hour-long sessions 4 days a week, and there were times when I know she didn't feel like doing the work, and yet we just had to keep going. So I treated her for about 6 months. At the end of that time, we reevaluated and had gotten her speech and language skills for about 1.5 to 2 years below age level. So we'd made some good gains. Then a couple of months after that was when she went in for the surgery.
Well, we knew after she had surgery that she was going to be paralyzed on the left side. So we knew that would be a major obstacle that she would need to overcome. And before we left Hopkins, we were only there for about a month doing rehab there full time. And we were really surprised when she was able to walk again. It was just really an amazing accomplishment. But we knew she still had a really long way to go because she was so weak and just had such a major brain surgery that we knew the recovery would be a long process. So we were so excited, though, to know we were coming back and we were going to be in such capable hands.
Really what we found out is that following surgery, this child would have to relearn to do everything again. She would have to learn to talk again and how to interact with people again and how to sit again and how to walk again and how to dress herself and how to feed herself, and really all those things that we all learn as we grow up and go through childhood. This child would have to relearn again at mid-childhood age, and that's a really hard thing.
But we wanted something, because of the number of hours that Cameron was going to be here per week, we wanted something close and convenient to home that was manageable so that everything else didn't seem so hard.
I took one look at Cameron and knew that she was perfect for this exciting program that we offer at High Point Regional. We offer a program called SABO, which is an arm training program, which is exactly what she needed for her left arm. Her right side worked perfectly. Her left side was weak, it was tight, it didn't move very well. And this program allowed us to strengthen her shoulder and her elbow as well as her hand to enable to do normal things like catch a ball, hold a bat, play on the playground, and do those things necessary to just be a kid at 4 years old when we started working with her. We worked with her with this program for at least 6 months to a year, 2 days a week. She had a strenuous home program that we put her through, and it was really exciting to see the progress that she made. She went from this weak little girl that couldn't move her hand to being able to hold on to things, carry her toys around, and play. Her arm's not perfect, but it's come a long way.
Well, they are super knowledgeable and extremely nice, and like I said before, very accommodating to your schedule. And you know, they're going to try the most latest technology available in the process, and we did some things here that weren't available at other facilities.
And we all got together and we had a meeting about this child, and we said, you know, talked about what her needs would be, and we decided that, yeah, we've got the expertise, we've got the equipment right here in High Point, and we can do this. This is something that we can handle. Through this surgery and through this rehabilitation process, these parents got their child back. And because Cameron's needs were kind of global, you know, she needed to do everything again. Because of that, she really utilized all of our resources. She was working with our speech therapists who have had, you know, 10 plus years of experience each working with children with these sorts of problems, speech and expressive and receptive problems, you know, understanding what people say and learning to express themselves. She was working with our occupational therapists and with dressing skills and with self-feeding skills.
And many of those treatments that we used with Cameron that helped her get back to being a regular kid are still being used now at the rehab center. We have lots of kids like Maggie Kilpatrick, who had a brain tumor and had a stroke during surgery. and we're using a lot of those same treatments with her. She is involved in our SABO brace program that helps people with brain injuries learn to reuse a hand that's not working optimally. And it's a really neat kind of robotic brace that is very neat looking, and it really allows these people to maximize the use of a hand. And she's also working out in our pool, our therapeutic pool, that is heated to 91 degrees and is comfortable for children. And it allows her to work on her balance in a gravity-free environment. And to her parents' shock, this child has learned to swim, even with limited use of an arm and a leg on one side. And she's just so thrilled that she begs them to take her several times a week to go swim. She has been working on our pediatric treadmill to learn to take even steps and to walk safely. And she has progressed so fast that here we are 7 months after her surgery, and we're working on running, and she can already jump, and she's learning to skip, and she can raise her hand up above her head. And the other day in therapy, she said, "Jenny, my hand, it's on top of my head. This is so exciting." And she is the funniest little thing. She really makes me laugh, and she's so creative. And to think where this child came from, to have difficulty standing on her leg and to have such frustration with her change in abilities, and to know who she is now is, I mean, that's why we do this. Working with Maggie is just so rewarding. And it makes you realize that this is why we are involved in this helping profession. And this is why we need all this specialty equipment and this expensive equipment that children require, is for cases like this. At the Rehab Center, success stories like Maggie's and Cameron's keep us going and get us so excited about the work that we do every day.
We were losing Cameron. I mean, she just really wasn't functioning, and she had no quality of life. And after the surgery, and because of wonderful rehabilitation, she is leading a very wonderful life, and I think a very normal life.
It was very fun with Miss Jenny, Miss Catherine, and Miss Carol, and Miss Pat, but I miss them so much now that I wish I was back with them in therapy, but I have to go on my own sometimes.